Hi, welcome to Stress Out Stress Free. Basically, today I'm just giving you an update of what happened after the my prostate surgery, right? So basically, update on my I spelled it wrong. The prostate surgery. All right, and we'll be right back after this message. Oops. Just go. Hi, welcome back to Stress Out Stress Free. If you haven't met yet, my name is Vincent Moon, where I have people like you stay stress free by changing one habit at a time. So basically today, I spelled it wrong. Prostate. Hold on a second, let me just double fix it right away, if I can. Basically this is just to update you with what had happened for the past week. Right, as you know, I had a surgery actually a week from yesterday. Tomorrow. Tomorrow gonna be a week, so 6 days today. So this is post surgery. It was last Tuesday. So one second, this is bugging me. Oh, 1 second, I just change that. Oops. Where did it go? Okay, just want to change that word there. I spelled prostate wrong. I figured it, You figured it by now. I should be able to know how to spell it, right? Okay, there we go. All right. So basically, just to give you an update on my post-surgery. Okay, so what happened was last Tuesday was the surgery, so I have to literally be there. The surgery was scheduled for 7:30, and I have to be there like 6 o'clock. So I have to get up by 4:30 just to get ready. They ask you to take a shower. Wash your body with high Bislin. It's the antibiotic soap. What it does is help clean the it's the antibacterial soap, so it cleans the body so that your body is clean and you will not get any infection. So yeah, I did that. Get up early and did that, and then we went to the hospital. And so by 7 o'clock, I was all dressed. They tested, they checked me and everything. And by 7:30, it's pretty nice. It's in it's in Memorial Sloan Catering, and I guess this is, they are top for the cancer patients. So everything there is nice and neat. They make sure people will guide you to the elevator, take you to the room, and make sure you all settle down. The people over there, the staff over there is incredible. They're all very friendly, and they want to give you the best, and they make you feel very, very comfortable, basically. So about 7:30ish, the nurse came and took me down. We actually took the elevator down to the operating room, and I literally walked into the operating room, and it's pretty cool. They have a nice warm sheet there, and next thing I know, they were saying, "Oh yeah, I'm gonna put the doctor was saying I'm gonna put the kind of like a massager that they wrap around your legs, so that wrap around my legs, actually my calves, so that it prevent." Testing 1 2. Oh, okay. Something's going wrong. Anyways, they were telling me, not telling me. So they gave me the massage leg massage. So it's like a plastic wrap around the leg. Yeah, it's the leg Velcro, and then they pump pressure in it. It's kind of like pump close to get rid of the. Oops, just take that away. All right, they pump it so to create circulation on the calf. So it's pretty cool. Let me see. Haha. Okay, troubles. No sound. Now we get it right here. I wonder why they come. There we go. It's on now. Okay, good. Yeah, thanks, Steve. So, excuse me. So it helps pump the bring circulation to the calf and the leg, so it prevents blood clot. So that was it. And then as soon as they say that, and then I said, my neck is uncomfortable though. So the nurse came with the roll of I think it's bed sheet. He put it in my neck, and next thing he knows that we're going to start putting anesthetic in you, okay? And the next thing I know is that I woke up, and I think I woke up. I went in there about 7:30 and woke up about 1-ish, close to 2 o'clock. 1:30, 2 o'clock, I think. Yeah. So what happened was, I woke up, right? So it's little dizzy, but little nauseated because of the anesthetic, and then you can feel like my face is all puffy, my mouth feels like really thick, my lips feels like thick, feels like this. So yes, so it feels that way. But the first thing I know is, they told us that as soon as you finish your surgery, drink a lot of water, and they just tell you drink a lot of water, so make sure that you're not dehydrated. At first, when I went in, right, let me show you. Let's see, let me put this. All right, and when I went in, they put in this IV on this one, right? And then they said, "Oh no, by the way, don't be surprised that you're gonna get another IV here." But I don't know why there's 2 holes here. But I didn't notice it until I came back. So, anyways, and then they have another IV here. They put a catheter. This one has 3 holes. What that is they actually, let me just change the screen. Oops. Okay. All right. What actually happened was they actually put catheter for a catheter. I didn't even know this. They have a catheter for the blood itself. They actually read the actual blood pressure from the blood instead of the pumping the pump that you have for the high blood pressure machine, right? So I guess they have one on my arm, and then the other one was in my vein itself, so that they will give the best reading and the most accurate reading. So they did that because of my high blood pressure. The anesthesiologist came in and told me that don't worry, we're gonna keep an eye on you, because that's how they make sure my blood pressure is okay, so that it will go up too high or down too high. So down too low, up too high. Okay, yeah. So that's what happened. So, and then I woke up like, oh no, there's stuff in there, and they have when they measure oxygen, they have that big clip, and what they do now is like they have a sticker thing, just like wrap around your finger, and then they have the put the tube up to the monitor and monitor you. So it's pretty cool, learn a lot of stuff there. Anyways, so I woke up, and then later on that I when I woke up, and then later on I believe it's later on the night, more to the evening, and there's a breathing respiratory rehab person, therapist, I guess, came in and said, "Oh, you were sound asleep, but did anybody tell you you have you snore?" I said, "Yeah." So he said, "You were sound asleep, but then you have while you're sleeping, you're snoring, but then you stop. So it's like that's no good. So then she pointed me to the machine, which when I got up, it was on my face. So that's the he said that that's CCAP, so to help you breathe. So they said maybe after this you should go see a general doctor to maybe put you in a sleep study, so then to make sure you don't have sleep apnea, and it's better to sleep with a CPAP because that will help you breathe better and it will not cause breathing problems." So and he said, "Yeah, I have one too because I'm the same." So yeah, that's like learn something new every day and pop up more stuff, right? So I don't know if I told you about the pre-surgery stats, pre-surgery testing and all that stuff. So last week, Monday was I went live, right? So the week before, I probably told you that, but anyways, the week before I went to the pre-testing, and they found out that and then the doctor said probably had to put me on statins for this blockage in the arteries. And then when I went to see the anesthesiologist, they said they did an EKG and they found out that first thing she asked me was like, "Do you have a heart attack?" I'm like, heart do you have history of heart attack? I said, no. Then they have to put me to the hospital to make sure to do a echogram so to make sure everything is okay before the surgery. So that was approved, and that's how we get to the surgery there. So when I woke up, I told you when I woke up already, right? I woke up and then the day was pretty fine. And then their goal is to want to make you get up and walk. Why? Because as soon as when you do the operation, right? What they did is they cut like 6 insertions around my navel. So what they do is they pump oxygen into the body, so it kind of like expand the stomach, so that they will not accidentally, they can see better, of course, and also they will not accidentally mess up your other organs. So that's why they want me to get up and walk. And so the first time was, I got up the bed and then I sat for a little while, and then I feel a little dizzy. But way before that, they were monitoring on my blood pressure, right? They were monitoring on my blood pressure, and what happened was I was getting a drink, and then the machine, excuse me, with the hand where the blood pressure machine is plugged onto the same hand I was using. So I was trying to get my water. That the machine went up, the pressure went up. So it started pumping. So I quickly put my hand down, and then that triggers a high reading. But I told the nurse, but he didn't really. I don't know. He's more afraid because of the blood pressure, but it's only like it went up to 170 over 80 or 170 over 90 or 100, I think. So for them it's like really high. I told them, "Oh, this is normal," but Anyways, after that, it was stable down a little bit. It went down to 150, and then he said, "Let's get up and sit on the chair." So I sit on the chair, right? So while sitting, I sat about maybe 5-10 minutes. Then I feel a little nauseated, and then also he checked, and I'm coming in to check the blood pressure. The blood pressure was high, so when he said, "Okay, I better give you a dose of to lower your blood pressure," right? So as soon as she put that in through the IV, and all of a sudden I feel like pressure, boom, rush onto my head, and next thing you know is that I have to grab a cup right in front of me and I start throwing up like blah. So that was the first throw up, and then she said, "Okay, I better." I see the fear in his face, like, "Oh no, shoot!" Like, and meanwhile, I'm worried about the throw up, basically it's all water, all liquid all around my nose, coming down my nose, and asking for a tissue or napkin. It's like I need to get you out of the bed. So I'm like, okay, just grab the towel that he gave me, and because I was sitting and it was cold, and I asked him for blankets and stuff, so I used the blanket to wipe all the gook away. All right, so that was the first throw up, and it's like and then he quickly grabbed me under the bed, and then as soon as he grabbed me on the bed, and then I said, "Give me the pen, give me the pen." I was like, blah 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 blah. It's like coming out of the mouth, coming out of the nose. Is thank God it's only water, it's not all food. So it's pretty not scary, but that's the first time, because I think my whole family, we are allergic to, like, and it's not allergy, but can take the effects of anesthetic. So it's like you just I throw up, so I get nauseated very fast. So anyways, so he put me back on, then make sure everything, the blood pressure is down and good, and he went down to 150 something. I didn't know, 140, yeah, and then after that I was fine. So come the next shift nurse, it's about, I think we tried one about 10 o'clock that night. So the nurse helped. This is the nurse now, the night shift nurse, and she helped me down, sent me down, and she said, let's try it again. Why not, right? So I sat down for a little. As soon as I sit down for maybe, this time it's a little longer, I think like 10-15 minutes, and I feel a little, my neck feels funny, and then feels like a little nauseate. As soon as I feel that, I just tell her, call her in right away, and we move back to the bed. And she said, okay, no problem, maybe you try later. So about 1:30, I passed gas, which is a great thing. And along the way, I have some burps and stuff, which is great because they pump so many CO2 in your body and so many gas, you feel like your belly is all puffed up and it's all gassy, and so that's why you need to let go of some gas. And the best one is to let go through your, you need to fart. That was the best one. But then throughout, after the whole surgery, I was burping quite a lot. So, and I found a way, like, as soon as I put my hand around where the insertion is, I start burping, so which is a great thing. Like, I don't know if it's a natural thing or, but if you ask me to burp, I can burp like on demand like this. Like, now I'm gonna put my hand on my excuse me. So I can put my hand around the incision again. You can just start burping like excuse me right away. So it's kind of cool. Or I think maybe it's normal for. Is that how it is? I'm not sure, but that way I lose a lot of gas through that way. So let's go to the chat. Let's see. Okay, my dad has one too. Oh, your dad. Oh, yeah, your dad has that one, right? That one too. It's a good machine. Yeah. What happened is instead of a massager, it's just a Velcro thing. It's just a Velcro thing, and just Velcro on your feet, and then it goes. So it expand and then close, expand and close, and it feels pretty good. And when I was in the hospital last time, it didn't feel that good because number one, that one was plastic. So this one, and also I had my sweatpants on, so it feels hot and sweaty. This one I have totally like barefoot. I mean, like I have nothing on, and what they do is they put on a calf, and it feels so good and comfortable. Yeah, echocardiogram. Yeah, okay. Echocardiogram. Yeah, your dad has sleep apnea too. Oh, that's a machine for yeah, good, yeah, because that's it helps keep you breathing, and you don't want to stop. Like my father-in-law has that. Like, we really don't know, but we didn't know about that until now. So I thought it's just like it's a regular thing among people, but older people. Anyways, so the excuse me. So the therapist told me and I have to look into it as soon as I can run around. So yeah. So what happened was, about 1:30 a.m. the day after the day of the surgery, so it's like midnight, and then my gas came out. So after that, it felt so good. Anyways, so by 2 o'clock, the nurse came in again. You want to try to walk? Yeah. So basically, I just got down. I didn't. When I stand up, I didn't feel dizzy or any nauseating. And then it's like, oh, let's go walk. So I ended up walking like five rounds around the floor. And it was good. Then I went back to sleep, and then did it the next morning, and it was good too. So, yeah. So they want you to come out like the next day or discharge you the next day. So by 12 o'clock, I was able to get out of the hospital, and then got home by 1:30. So it was a nice and comfortable process. As soon as I came home, I have to look for something to wear, right? Because I cannot be putting on my pants all the time because of the catheter. And then before I left, they say you have to put cannot leave the bag on the floor, because the pee bag on the floor, because it might cause infection. So what I did was I found a bucket. Uh, I used the bucket here just to soak my leg, and let me just show you too. Yeah. So this is the bucket. This is like a water bucket to soak your leg. It's a Korean style, and you have to put the. So what I did is I put the pee bag in here. So just make sure that the tip is free from bacteria. So and make sure it's free, and of course I sterilize that before I put everything in there. So I have to stay clean and make sure everything is clean, and even with draining the bag, I have to like make sure the hands is sterilized, and I have gloves on it. So I brought a bunch of gloves from the hospital too. So yeah, and then that first night, I felt like shoulder is tight. They did ask you that, because at the hospital, do you feel any pain on the shoulder? I said no. So when I came home, I feel a little achy. So I didn't know. I just went to bed to sleep. And then when I get up the next day, it's a little painful too. So what I did is, before I go to sleep, I didn't bring it. Yeah, I find I have them all the time. A small acupuncture pin. It's just like a. Actually, let me see if I show it to you. I just pull this one out. I have a bunch of them here, but can I? Let's see. Let's see if I can show it to you. Oh, 1 second. I put my shoulder here. You see this? Oops. A little bit more. this camera is too far away. Let me see if we can adjust it a little bit. This acupuncture pins. Alright, there here. See up here? That one there. So basically, it's like a small pin in the middle, and it has a kind of like a tape on top. Let me try to show you one more time. Oops, hard to focus. Right there, you see this one here? Right there. So it's like a pin in the middle, and it's a small square. And so basically, you find the tight spot on where the pain is, and then you just put one on top of it. And what it does is it's an acupressure pin, so it will release all the chi and tightness around the area. So by the second day, I got no more pain, and it's so comfortable, yeah, it's comfortable and no more pain. I'm so surprised, and with the even with the insertions around the nail, right? All I feel is just like stitches. How when your muscles a little tight, they kind of pain. So because it's like they have like 6 cuts, so it's like around like. This is the navel, right? It's like around here, like these 6 cuts across the belly button. So, of course, when you move, you feel pain. Right? First night was a little tough to get on my bed. And then the second night was fine. I could just lift my leg up and then go 1, 2, 3, whoops. Just move my body up. And then I came up right away. So even the abdominal area doesn't hurt as much. So thank God, And thank God also for the catheter, because all I need to do then is just drinking a lot of water. I'm good at drinking water. So in the hospital, I was like drinking lots and lots of water. And at one point, the nurse came to empty the pee bag. She's like, she went twice already, and then she came back again. I'm like, there's more. I said, yeah, there's more. And then that's when she took off the IV from my right hand, because at first when I went in, they put the IV on my left hand. Right? They said you're gonna have one on the other hand, and just to keep you hydrated. So they basically have two IVs into my arms and into my hand to keep me hydrated. So what they worry about is you're not drinking enough water, and your muscles gonna be you need to hydrate your muscles. Okay, so yes, so it's important, like even us as normal, we should drink a lot of water to keep our muscles hydrated. Okay. All right. So basically, the pain was not bad at all. It's not like intolerable pain, and thank God, the next day and the last few days, I've been feeling good, better and better, and also, thank God that I have the lumbar cushion, and also the seat cushion, which I always tell you guys, it's from my friend from Elver Relief, and she used to sell them both in on Amazon, but now they only have the lumbar cushion. They have one in Amazon, and then the seat cushion she's not selling that there, but there's a couple that I recommended in a few other videos, from Amazon, and you could get that, that helps so much, because what it does is with the lumbar seat hold my back, right? And the first day I was sitting on a big sofa, I just feel like it's hurt. My back is hurting, and my of course my butt is not on it's on the regular cushion. It doesn't feel good. And since I've been using the lumbar and the seat cushion. It just help hold my butt, my butt, and it's like no more pain, and even it help with the insertions on the belly itself. Of course, that's the insertion from the surgery. Yeah. So okay, let me just go to the chat and see. My grandpa never used this, and my dad's friend, I don't know. They were not covering here. Okay. That's good. And it went well. Yeah, it was good. And no complication. That's the thing, So what happened is this hospital is pretty good. They call you like every day and check to make sure that first 3 days, I think. I get calls until like Friday, and then they check on you, how you doing and everything. And also there's an app that I have to take like a survey that I have to every day for 10 days after post surgery, just to make sure that yes, same questions like are you nauseated? Did you go to the hospital? How are you feeling now? You used to have pain or redness in your seizures and stuff, and they're pretty good with that. Yeah. And then after this, they told me on Friday that the doctor wants you to take the catheter out on Wednesday, which is about 7 days. So for today's Monday, right? So by Tuesday, I have to start taking antibiotic, and then by Wednesday, I should be able to pull the catheter out. So. No complication. Still, yeah, that's why I show you the bucket. I had to put it basically for 7 days, a week or so. Yep. Yeah, the lumbar cushion is actually really, really good for the back. And I don't have it here. I have it on my chair on the other side. It's hard to kind of like, pain in the butt to go get there and show it to you. I'll show you next time. I have the lumbar one for the back, and then also we have a seat cushion, which is the best, I guess. Thank God for that. If not, my butt will be aching, and how they put pressure on your butt if you sit a lot. And also, I was supposed to most of the time walk off, so that and then the more they are suggested that the more you walk, it will help the burping. Gas is coming up. Oh yeah, one more thing. So sometimes when you feel like gas try to come out, can't come out, as soon as you feel the pressure coming, try to burp, and it helps really, really much. And I've been doing that since after the operation. It just helps, because if not, you just feel like the gas is in your body, and it's like sometimes you feel that gas and it's very painful. Yeah, if you try to burp a little bit, and then it will help release the gas too. It's pretty cool. We learn things all the time. Yeah, that's good. It's coming out soon. Yeah, the cushion too, it is good. Okay, yeah. Okay, you use that too. That's good. Yep, it hurts sitting down too long. That's why. Remember the one of the shows we have, like what sitting down can cause you. I think sitting down too long, that's bad for you, right? Yeah, because you need circulation. And your muscles need to move a little bit, and you need circulation. You need to take breaks, and that's why you need to get up and do stuff too. So that's why it's so important not to sit too much. Anyways, so those have been helping me a lot, and also the acupuncture pin that I use for my shoulder, and my muscles. So I still use them, and I should have shown some on my neck. I have some on my neck here that I don't know if you can see from there, but yeah, there's one here. There's two here actually. So yeah, so I put a bunch on them, so that help to release all the pressure and it's working fine. Thank God that I was thinking of expecting pain, but I have so much peace in me, and then I don't feel much pain. And thank God, really thank God for that. For that. So yeah, and also like the day before my surgery, my brother has a client that he called me out like, hey, once he did his surgery 5 weeks ago, and so he called and give me some tips. Thank God for him too. Maybe someday if I can, I get him to be there. Then we talk about more on prostate. If anyone will be interested, that we good to know. Or it's good to have the information out there, because sometimes people might feel like scared, or worry about stuff that basically they don't have to. But and of course, when you first thing you hear is that you have prostate cancer, it's like, now what? It's the C word that's like people get scared. So in fact, yeah, it affected not very much me, but my wife for like first 2 months, because first thing you hear about cancer is like, oh no, it's no cure. And then as soon as, actually first month, first few weeks, because as soon as we found a doctor in Yukon, my son works in Yukon, the University of Connecticut Hospital, and his boss knows the top prostate surgeon in Yukon, and so he connected, and we took us a while to get the appointment, but we got it in October. I mean, like before the end of the month, and it was good. It was at least he gave us like hope, I guess. He said, "Oh, this is just the first stage, and this is just the beginning. So it it's curable. All you need to do is option is probably just take it out. But I want you to get a second opinion." And we did get a second opinion, but then he did tell us that it's going to take a few months to get an appointment. So in January, we was able to get an appointment with this doctor here. His name is James Isham. He's a prostate doctor, and so we met with him, and his people in Slum Catering are so nice, and they keep you well informed and stuff. So it's pretty cool. So thank God for all the connections. Or he only gave me the best. So thank God for that. Okay, let's see. That's why I get up, make walk every few at least. Yeah, actually they said every 50 minutes to an hour you should get up and walk, and just to create circulation, or move away from your desk or your seat or whatever you're doing. Just move away, and that will help your circulation and stuff. So which is a good thing. Yeah, of course your posture is very important too. All right, I think I've been babbling a lot tonight, and hopefully we can go back to our regular schedule on Thursday and Friday. But I still have to see how it goes, and I'll keep you informed. Okay. All right. Thank you very much for watching. Yep. All right. I guess it's pop up right away. I forgot to put those away. But anyways, so stay stress free. Let's stay stress free by changing one habit at a time. And I see you in the next video. Okay? Thank you. Bye bye. Yeah, still say, walk in the house. Yep. That helps too. You don't have to go out and walk. Yeah, it depends if you're raining. Like, it was just pouring just now, so it's a partly cloudy, but it's pouring today, so it's crazy. Anyways, have a good night, and I see you in the next video. happen to myself.